Uh-oh, Daniel. I think I lost my. All right. For the next 2 hours, we're going to be talking with you about, of course, the impact of the coronavirus on Southeast Seattle and surrounding communities. And again, we started this on March 13th. And at that time, no, I did not think that we would still talking about this. Not only that, but it's gotten worse. It's getting worse. The foreseeable future has things in our place that may make a difference, like vaccines. We have more knowledge about what this disease does, but then there are also the awareness that there are things that we still don't know. And then along with this, the potential of other respiratory viruses coming along and the way that this has changed our behavior through everything. And it impacts everything. So, of course, we'll continue to have these shows because the landscape fluctuates. Joining us a little later on in the show today will be William White from My Brother's Teacher. And he's going to talk about a program to basically, the bottom line is get more black men interested in early childhood education. And we'll tell you why that and how that impacts the coronavirus, as well as just finding out more about that. And also here will be from the United Way of King County, the president and CEO of United Way of King County, Gordon McHenry Jr. They're going to tell you about their rent assistance program. And again, find out more about what the United Way of King County is doing during the pandemic and how that's changed and affected what they do. And joining us will be Joseph Sayed, Executive Director of Pacific Islander Community Association of Washington. And we're going to be talking specifically about how Native Hawaiian and Pacific Islander folks have been impacted. There has been a grouping. There's a historical reason why this is taking place, which maybe I'll let Joseph go into, about what's called the API community, Asian Pacific Islander community. And there's distinct differences. The coronavirus has shown that in the way that the Native Hawaiian community and Pacific Islander community have been impacted as opposed to the white community or the Asian community. 7 times worse, if you just want to put a number to it. And so we're going to talk about that. And joining me is someone who's been on the show before. And recently, the organization CHILDCARE Aware won an award, and so it's also a good time because it's never a bad time to talk about early education, our child care workers. People are going back to work now more. This is something that you see is not going to go away. And so welcome to the program, Mr. Ryan Pricco, Director of Policy and Advocacy for CHILDCARE Aware of Washington. Ryan, how you doing?
I'm doing good. How are you?
Under the circumstances, fantastic. And I'll share a little bit about Ryan. He directs all policy and advocacy efforts for CHILDCARE Aware of Washington as an effective voice in Olympia for children, families, and caregivers during the state legislation. When the legislature is not in session, Ryan focuses on grassroots engagement, policy development, system messaging, and representing us at key meetings with state-level partners and raising awareness of the importance of high-quality child care. Ryan, that all kind of sounds kind of wonky. I mean, I respect it. You know what I mean? But tell us.
I think my staff wrote that up. They're very complimentary.
Tell us what you do.
So I direct all of our advocacy services for CHILDCARE Aware of Washington. And CHILDCARE Aware is a nonprofit that is based throughout the state. We have 6 regional programs that serve every community of this state. CHILDCARE Resources is a program based in Seattle that serves all of King and Pierce County. We were originally set up to help families find childcare, and we still do that to this day. But over the last 30 years, our work has expanded to also support childcare providers in sustaining their business and providing quality care, as well as our policy and advocacy work to try to make sure that we raise the awareness of accessing childcare, how harmful it is for communities that struggle to access childcare, how the impact that has on the economy overall, And my job is to work directly with policymakers to connect them with people on the ground that are impacted by the childcare crisis so that they can actually begin to take steps to actually address the crisis and ensure that families get what they need and the economy is able to grow.
And you heard me connect this to early learning, early education, I'm going to let you explain again why this is a critical time and how those and why those things go together.
Well, early education is probably the most important thing that we can do as a society. It should be our top priority. Over the last 20 years, our brain research has grown exponentially, and we've learned so much. And the biggest thing that we've learned is that the human brain, not over 90% of it, develops by age 5. So almost over 90% of a person's brain develops before they ever set foot in a kindergarten classroom. If we could go back 100 years and set up our education system again, I'd like to think that we would have done so starting in the early years, recognizing that that's where you actually have the biggest impact with education. Because how well that brain develops is dictated by what that child experiences while that brain development is happening. So if that child is nurtured and loved and cared for and stimulated and receives cognitive development, that brain is going to develop really, really well. And then when they go into school and into their careers, they're going to be more successful. The research is really clear about that the return on investment in early education is better than anything else that we currently invest our dollars in.
And
And our economy has shifted immensely over the last 50 years. You know, it used to be that everyone received their early education from their stay-at-home mom. That's not the case anymore. Now the majority of America's mothers are working mothers. Over 60% of our young kids live in homes and grow up in homes where all adults are working. And so more and more kids are spending that critical brain development time in childcare. Kids in childcare spend on average over 30 hours a week in childcare, while over 90% of their brain is developing. So the quality of childcare and the ability to access quality childcare has a direct impact on how well kids do in school and how well they do throughout the rest of their life.
And I'm going to add in here because you just said it, and I don't want to think people. I don't want people to get the role that fathers play matters too, and the role that men can play is just the same. It's about making connections, and that's part of what early education is. So when they say parenting, it's not just women. It's critical things that happen and roles that fathers can play as well, and that's what early childhood learning is all about. It's about parental engagement, and sometimes that looks different in different homes and different households.
Mhm.
But and again, I'm going to use one of those $10. We're talking about evidence-based research. This isn't just guessing. So yes, a lot of the things that you learned a long time ago that made sense are important and critical things to do at an early age for the development of the brain. And we know this kind of stuff now, again. So when we're talking about childcare, um, especially during a pandemic, um, one of the positions that was deemed essential workers by the governor were childcare workers.
Mhm.
And let's talk a little bit about why that was the case, because people probably don't think everybody had to try to figure out how they were going to go about doing what they were doing, but children children still needed care, and there were going to need to be people there in order for lives to go on.
Yeah, I mean, from the moment that this pandemic started, childcare was one of the first groups deemed essential workers, and the reason is pretty straightforward because doctors have kids, nurses have kids, firefighters have kids, people that work at grocery stores have kids, and they can't go do their job if they don't have anywhere to take their kids. So from the very first moments of the pandemic, the government has asked childcare providers to step up, to put themselves at great risk in order to care for the kids of essential workers, and they've responded. They inspire me every day. The pandemic has definitely taken a hit because of financial reasons on the childcare industry, but at no point was any less than 75% of our childcare programs open at all times throughout this pandemic. And they are scrambling in order to provide that care to all of those essential workers with very little support in an environment that is very, very dangerous for them and very, very difficult to navigate.
My guest again is Ryan Pricco, Director of Policy and Advocacy, Child Care Aware of Washington. Just wanted to talk about a few of these things. Put a face. Put. Who are the folks who work in this area of childcare? Um, it, where do they come from? Um, who are the people generally? And if you can generalize, if you can't, I know you can put a face on it because there's a face on it. Who are these folks who are childcare workers?
Well, the face of childcare is really the face of our communities. Unlike what we see throughout the rest of our education continuum, childcare is made up of community-based organizations that were developed in communities by the families that live there that need the support in order to work. They're one of the most poverty-stricken workforces in our country. They rank in the third percentile of all occupational wages. Almost all of them are women. Well over 90% of our workforce are women. They are disproportionately women of color. They are disproportionately immigrant and refugee women. I believe about 25% of our workforce is either bilingual or multilingual. So the face of childcare is the faces that you see around you in your community. They are essential workers who are delivering an essential service with hardly any support, particularly from government, in order to provide a public good. The bottom line is that if childcare is not available, not only does that hurt the kids in those communities, hurt those families, hurt those workers, it hurts those employers, those businesses, and the economy overall as well. Childcare was in crisis before the pandemic hit. The pandemic has made it worse. And if we don't do something to provide direct and significant support directly to the women who make up this workforce right now, I'm afraid that there's not going to be much of a workforce left over by the time everybody is able to return to work.
Recently, Child Care Aware of Washington was honored in November with the Washington Advance Award for the Association of Washington Business. And you know what, Ryan, when I saw that, I just thought it was a good reason to get you back on the air again so we can tell folks what's going on in our child care system. But talk about that award for a second here and what that award was for.
So that was an award given to us by the Association of Washington Business. They are the state chamber of commerce for Washington. They are a very influential business association that represents all types of businesses, from the smallest businesses to the largest. And they've been a great partner of ours over the last couple of years because they recognize how important childcare is. They started hearing from their members who are employers about how many employees their businesses were losing due to families not being able to access childcare. How often their employees were leaving work early or coming in late due to inability to find childcare. How much their families had to go on leave if all of a sudden their childcare program shut down. They recognized that this was hurting their bottom line. This was creating turnover in their workplaces. And they reached out to us and wanted to know what to do. And we've been partnering with them ever since to engage employers and business leaders to really push them to be a strong voice for childcare and really be a strong voice for these businesses. We've done a lot of great work together, and apparently they recognize that as well, and they decided to nominate us for, they have an annual awards event. They give out many different awards. We were nominated for a couple, but the two that we were nominated for were basically intended more towards nonprofits like ours, who are doing great work in the community in order to address critical needs within the community. And that's ultimately the award we won. We were very honored to receive it, and we're very excited that the business community is finally really starting to get engaged on an issue that directly impacts them.
Well, you know, Ryan, I think that it is awesome that an entity that recognizes the importance of taking care of our youth at the most vulnerable times in their lives when that brain development, again, is critical, and a lot of things that can be corrected later on in life can be fixed through early education. I know I'm making that really succinct. But again, without throwing a whole bunch of stuff out of there, we have the evidence-based research to prove that. We have the financial understanding of how that benefits society as a whole. So that's just great, man, that you guys won that award. Awesome job.
Yeah, well, thank you. And, I think everything you're saying is absolutely right, and really why AWB and other organizations like them are getting involved, because they not only see that this is impacting the economy right now, that the childcare crisis is keeping a lot of people out of the workforce, especially women. But they also see that long term, if we want to develop the workforce of the future, then you're absolutely right. We need to put all of our money into those early years make sure that early brain development is maximized, because it's been proven to reduce costs in K-12, reduce remediation, reduce special education, reduce kids that end up in the Department of Corrections or end up on state dependency. There's just so many positive benefits from focusing in on those early years, and more childcare providers are those teachers that are providing that education in those early years.
All right. Well, thank you for unashamedly joining me on that soapbox for a minute.
Hey, anytime. I'm always happy to get on that soapbox.
But if you missed our show previously, we talked a few weeks ago and we found out where childcare was at that particular time. And that's where it was at the moment. You can go back to our archive and listen to that. And so here we are now. So from the last time that we've talked, where is childcare at? What has changed? Have things gotten better? We know the virus has gotten worse. We hear about the hospitals being stressed into the breaking point, even potentially further. What's going on with our childcare network and our child system during this time? And again, if you can maybe start about, okay, what you've learned over the last few weeks, or maybe in months, or maybe this is still all, too chaotic at this point to really feel like you have a grounding on what you can do and what's going to be next.
Well, you're absolutely right. It is very much a fluid situation, and we're learning things every day. We've really recommitted our staff statewide to just focus on outreach to child care providers and families seeking care, to continue to learn from them. What is the impacts of all of this, and where do we need to deploy our resources in order to try to help as many people as possible? But since we last spoke, unfortunately, as you said at the beginning of our conversation, things haven't gotten any better. And in most cases, they've gotten worse. So currently, like 14% of our childcare programs are closed. That's primarily due to just a lack of enrollment. The fact that so many more people are working from home or not working at all results in about a 41% decrease in enrollment on average across the state. So that's a 41% decrease in income for these childcare businesses. They're doing everything they can to hold on right now because they know that all those parents are going to come back and need a place to go, but they're really struggling. But almost 30% of our childcare workforce is currently furloughed or laid off, and 42% of our childcare programs are.
Do those folks get unemployment, or do they have? Is it set up for them to be, or do they have to jump through? And maybe you don't know, but I'm figuring you might know what happens to them. And I want you to continue here, but what happens to those folks when they lose these jobs?
Well, yeah, I mean, hopefully they go get on unemployment. And, as I mentioned earlier, this was already one of the most poverty-stricken workforces in our country. And so these were folks that when they're employed, they were already low income. I think over 30% of our childcare workforce is eligible for state assistance through, food, housing, healthcare, whatever it might be.
And this is before the pandemic.
Yes, yeah. This is when they were employed, before the pandemic, and now a lot of them are unemployed. So what we know is that hopefully they're on unemployment. We know a lot of them, because they're such low-wage workers, they're looking for something else. We can't count on them to come back and care for these kids. And we also know, because the federal government has failed to come through with another stimulus package, they're not getting extended benefits that were maybe available to them back in the spring and the summer. But one thing I really wanted to touch on that is quite different now from the last time we spoke is what's happening in K-12 and the impact that has on childcare. So most of our schools across the state are not, not doing in-person instruction. But as we talked about at the beginning of our conversation, those essential workers still need to take their kids somewhere. They still need to take their school-age kids somewhere. So now those kids are also in childcare, and childcare providers are being asked to buy laptops, increase their Wi-Fi, and try to conduct remote learning for these school-age kids. I've heard 40 of them in one program at a time, with a couple of floaters basically in a big warehouse room trying to help them with their remote learning. It's really just an awful situation that these kids are in, and over again, our childcare providers, again with hardly any resources, are being asked to take on the work of others and do what's best for these kids, and they're doing as good of a job as they can. But my message here today is they need way more support. And every day that we wait to get them that support is another day that we're losing brain development, that kids are falling farther behind. And again, all of this is disproportionately felt by low-income communities, communities of color, and communities with language barriers.
My guest again is Ryan Pricco, Director of Policy and Advocacy for Child Care Aware of Washington. You know how we get down on this station. It's not a matter of trying to tell you what to think or how to think or make you feel bleak. It just is what it is. And so if some of you are listening right now going, well, wait a minute, that's not good. Right. It's not good. The coronavirus is impacting our communities in a number of different ways. And so one of the ways you might not hear about a lot is those who can't speak for themselves. Those are who are one, who are two, who are three, who are being impacted and how this is impacting. And again, this is the child care safety network, if you want to call that, you know, the place where when those of you have to go to work, you have to take your kids somewhere. This is that safety net that we're talking about. So in regards to before, do we know if there are protections in place, you know, Ryan, good, bad, or whatever, because there is still a coronavirus. And there are kids can get it and be asymptomatic. We've also recently, and it's not a great sample size, found out that this can also do harm to kids and can have, again, without a great sample size, it also has lasting effects. What kind of PPE is in, you know, PPE is in place, the protective stuff? Is there government money coming in to make sure that those types of things need to be there? Do we know, which is pretty critical, you know, the rate of contraction of this virus that could potentially impact kids who can go back to their families and give it to their families. And we know this, we know about nursing homes and places where adults are, but do we have that same type of information? And is there that same type of attention given to those who are taking care of the babies?
Yes, absolutely. The CDC has provided direct guidance for child care providers. Our State Department of Health has adopted them. Those requirements have basically been passed down to child care providers. And once again, they're being asked to just kind of take that on and figure it out on the fly. There has been some support provided by the state and federal governments, and we're absolutely appreciative of that. But to be frank, it's not enough. And our organization has raised our own money on the side through donors and in just a public donation process to raise thousands of dollars to distribute PPE supplies to child care programs. But right now, child care programs are being required to operate in smaller group sizes than they normally do, which means they have to have more staff per child than they normally have to do. They have to be completely outfitted with PPE supplies. They have to sanitize their programs every night. And they've really become innovative at incorporating and developing new routines with the kids that encourages and incentivizes them to practice social distancing and not share toys and develop new lunchtime routines so that people are more spread apart. During the summer, programs, you know, utilized a lot of outside activities in order to remediate the risk. And we've certainly had some instances, some exposures in programs, but at a far less level than we were expecting, far less level than you see in other sectors of our economy for sure. And we have protocols in place with the state and everyone else to address those when they happen. So if there is any chance of exposure, the program is shut down for a couple of weeks, you know, testing is made available, whatever needs to be done, you know, the state can then step in with more resources. But the overall day-to-day impact of this is that the coronavirus and the safety requirements that come around with it has greatly increased the cost of providing care for these child care businesses. They're doing everything they can to try to not pass that cost on to parents who are also struggling right now. But it's just another reason why we need the government and anyone else, really, anyone with resources to step in and provide support so that programs can stay open and parents can continue to work.
Again, we could continue to talk, and there's a lot of questions that I have, and thank you for giving me, you know, direct, frank answers to these questions. Since we've only got a couple minutes left, I want to give you the opportunity for final words here in case there's something that you just want to share with our audience that's listening right now.
Well, I mean, I think anyone that's listened kind of understands the overall tone that I have about this, which is that childcare is the most important part of our education continuum. And I believe childcare providers are the most important teachers that we have in our society right now. And I say that as someone who's married to a K-12 teacher, so hopefully she's not listening right now. But we need to do more for this sector to reflect how important it is. We need to invest in childcare and early education the same way we invest in K-12 and higher ed, to make sure that it's high quality, that it's available to everyone, and that families don't go broke paying for it. We have a system set up right now that is almost entirely funded by young families. Those are the poorest families that we have in our society. It has created a broken market. It is a drag on the economy, and it stunts early brain development, critical early brain development for our kids, and it's disproportionately being felt by our most vulnerable communities, our most vulnerable people. And it's far past time that we make it the priority it deserves to be. Currently in our state budget, less than 1% of our state budget is dedicated to childcare. Over 50% of it's dedicated to K-12. I think almost 20% of it's dedicated to higher education. Our state policymakers need to create a budget that is reflective of how important childcare is. They understand that, they say all the right things, but ultimately you tell everyone what your values are by where you place your money. And right now people are not putting money towards this critical sector. And if they did, then they would create new money in the economy. They would increase earnings across the board. They would increase revenue that could go to other human services. They would reduce costs in K-12. They would reduce costs in corrections and state welfare. And all those costs are going to continue to rise until we finally get serious about the most important part of a person's life, which is the first 5 years of their life.
Ryan, thanks for joining me, sharing this information. Congratulations on the award.
Thank you very much. We're very honored. And it was great to talk to you, Tony.
Okay. And, man, we'll have to check in again in a couple months. Who knows where this is going to be, but we'll check in again.
Yeah. I mean, who would have thought that we would still be dealing with this last time we talked? But, if this continues, I'm always happy to come back on. And thank you for having us and for raising awareness of this issue. We really appreciate it.
You're listening to Rainier Avenue Radio, our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities. Coming up will be Joseph Sea from the Pacific Islander Community Association of Washington. We'll be talking specifically about the impact of the coronavirus on Native Hawaiian and Pacific Islander communities. And again, the movement, we'll see what it's called, that's going on right now to disaggregate that community from the Asian community. Again, one of the things that I said is if it's lumped in together as one thing called API, but a percentage of that group is being impacted and affected more, that's an issue. And it's become even more critically aware now with the pandemic. We'll be back right after this.
This is Paul Pearson, host of Star Time, and when I'm not busy tearing the roof off the suckers, I'm listening to RainierAvenueRadio.world.